Hello, it's nearly 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available for you in English. Vice Health Minister Kim Gang-lip will be briefing us on the coronavirus situation here in South Korea, filling us in on the number of new infection cases seen as of midnight and what kind of efforts the government is making to contain the virus, especially with the spurt of cluster infection cases in the Seoul capital area. Now, the new transmissions have been popping up in cafes, restaurants, religious venues and in offices as well, and the government is doing its best to contain them, but for now we will hear from Vice Minister Kim Gang-lip, who has taken to the podium.
8월 20일 수요일 정례
Let us now begin our regular briefing for August 20th, Thursday.
현재 우리는 서울과 경기
Right
지역에서
now,
발생한
in
집단
Seoul and
감염이
Gyeonggi-do Province, we are seeing a cluster infection, and it can lead to a nationwide infection at any time. And as a member of the quarantine authorities, I have a grave responsibility, and now let us begin our regular briefing. As of today midnight, we have a total of 276 new local infections. In Seoul, we have 135 infections, at Gyeonggi 81, and Incheon 10. A total of 216 in the Metropolitan Area, with the majority of the cases being clustered in this area. The Headquaters Jail Church and the Liberation Day rally, and through these big cluster infections, we are seeing chains of transmissions into office buildings as well as other contacts. And we also have cluster infections, numerous of them with unidentified sources of infection. In relation to the Seoul City's Headquaters Jail Church, as of today, we have tested a total of more than 3,600, and we have 62 more people tested positive, and a total 630 people have tested positive, and right now the infectious rate stands at 19.3%. And the virus has spread to about 11 venues, and a total of 114 venues, including office buildings and other multi-use facilities, and therefore this calls for more stringent measures as well. And to this end, the government has designated respective officials who will be in charge of the quarantine measures for each of these venues. And through epidemiological investigation, we have additional lists of visitors to the church and church members. However, there are people whose whereabouts are not confirmed, and there are also a total of 700 people whose whereabouts are unknown. And we have cooperated with the police, and we have gathered their mobile numbers, and we are contacting them on a regular basis. And as for the Liberation Day rally, as of today midnight, we have a total of 23 new local infections, and among them 33 people are of the Headquaters Jail Church, and we also have 20 people who are also with unidentified sources of infection, and they have been dispersed to a total of 19 cities and provinces nationwide, and about 70% of them are in the higher age group. And the government, in order to identify all of the members who were attended there, we are utilizing the mobile carriers' data, and we have been also asking for the list of the people who have attended and who have boarded large buses that left from each of the provinces. And in order to secure your safety and that of your loved ones, it is most important for you to get tested if you have visited the rallies or the church. So we once again ask you to do so immediately. Recently, there are also some fake news and ungrounded rumors that have been spreading fast, and there were also people who are reluctant to get tested as well. And this is raising worries from the government. And the diagnostic testings are carried out by private clinics. The government cannot intervene in the process, and there is no reason for the government to manipulate such test results. And as for these ungrounded rumors, the government has never intended such measures. And as for all of the contacts that have been come into contact with the members of the church are being tested right now. So we once again urge the members of the public to act rationally as well. And we ask the media outlets to always verify these fake news before reporting on these news. Next, in the metropolitan area, we are exerting our full efforts to have a joint response scheme. And in relation to an increase of the number of cases here in the metropolitan area, we have run a special emergency team starting from the 17th of August. And we are exerting our pan-government efforts and cooperating with other branches as well. And we will be revamping the system once again to be fully prepared. And as for the people with light symptoms or no symptoms at all, they will be administered to life treatment centers so that we will prevent an overuse of the number of hospital beds. And depending on their chronic illnesses as well as seriousness of their conditions, we will clearly categorize the people who will be administered to these life treatment centers, and all of these decisions will be determined based on the decision made by medical practitioners. And moreover, at our monitoring and situation room, we will be considering and continuously monitoring the situation so that we can utilize a joint use of the hospital beds. And here in Seoul, the Seoul city has great capacity to deal with the intensive care units, and the Gyeonggi-do province has a lot of sufficient number of hospital beds. And we believe that the cooperation between the two can enable a joint use and more effective use of the hospital beds, as well as other medical resources like ventilators as well. And we will be also exerting our full efforts to secure enough number of intensive care units as well. And we will continuously to make more life treatment centers as well as more designated hospitals so that we will have no patients be left out. And we will also make sure that we will increase the number of hospital beds at the designated hospitals by 260. And yesterday, the Seoul City's Taeneung Training Center has been opened as a new life treatment center, and we also have a similar center available in Gyeonggi-do province as well, which will be helping us to be fully prepared for exponential surge in the number of cluster infections going forward. And these cluster infections that has spread starting from the metropolitan area are now stemming through their family members and a number of other contacts. Especially, we are very worried about the spread of infections through the Liberation Day rally that was participated by a large crowd of unspecified people. And the government believes that this is a very important crisis, and we believe that this is a very important time in a moment of time as well. And we ask the members of the public to cooperate and to continue to stay vigilant so that our crisis will not be enlarged going forward. And we also call for your continued cooperation going forward. We ask the residents living in the metropolitan area to refrain from making non-essential outings, except from going and commuting to work, as well as going going to hospitals. And please note the seriousness of the condition, and please note that you can be exposed to the virus at any time, anywhere in the metropolitan area, and also continue to wear your face mask and keep your distancing measures. The situation that will unfold this week will be crucial in determining the fate of our outbreak, and please refrain from making gatherings this weekend, and also refrain from making travels as well in between provinces. We also have increased sources of unidentified infections, and we also have spreading infections through different provinces as well. So we ask the members of other provinces to also stay vigilant. And next, we would like to touch upon the issue of the collective walkout of the Medical Association as well as our joint dialogue. And last afternoon, we had a negotiation session and a dialogue between the Korea Medical Association and the Minister of the Health Ministry. And the ministry has also advised the administration to keep in a dialogue, and also especially at a state of seriousness amid the spread of the COVID-19. And we also encouraged the administration to refrain from making unilateral collective actions. Nevertheless, the Korean Medical Association has also called for the withdrawal of all of our measures to increase the number of entrants to the medical schools, and they say that they will carry out their scheduled walkout. Among the spread of the COVID-19, which is especially exacerbated here in the metropolitan area, which is a very grave moment, it is a time for the government and the medical practitioners to cooperate to save the lives of the public. Against such background, we also once again urge the Korean Medical Association as well as the Association of the Trainee Doctors to withdraw your scheduled walkout and re-engage in negotiations and dialogue. Despite such a background, if you continue to carry out your walkout, the government does not have any other choice but to carry out very stern measures as well, based on legal perspectives. And if you carry out your walkouts, the public anxiety will be enhanced forward, and all of the losses and damages will be incurred by the patients. So we ask for you to engage in negotiations, and the government will also be prepared so that we will never put at risk the safety and health of the public, and to alleviate any of the inconveniences. And we once again urge these associations to refrain from taking collective walkout and highlight the importance of safety and health of the public. Thank you very much.
That was Vice Health Minister Kim Gang-nip that we just heard from there, updating us on the COVID-19 situation in the country. We just heard that there were 288 additional infection cases of COVID-19, bringing the total accumulated number of cases to 16,346. Now there was one additional death, bringing the total death toll to 307. That wraps up our coverage of this morning's briefing. We will be back with our regular newscast at noon Korea time. Bye for now.